The abnormal toxicity test was developed in the 1900s to quantify phenol-derived preservatives as a quality control test for diphtheria sera. The ATT was also known as the General Safety Test, or the Test for Innocuity. The test was first carried out on guinea pigs, and later on mice. By the 1950s, the ATT became the standard test globally for detecting contaminants and toxins in finished biological products. It was adopted into a host of regulations worldwide, but as a general safety test, rather than for the original specific purpose. In the 1980s, a significant shift began in scientific consensus on this test. At the same time, the production process for vaccines and other biological products made great progress in preventing contamination and ensuring safety. 1996 was a turning point. Several key studies highlighted the inherent limitations of the ATT as not specific, lacking relevance, and not reproducible. These findings demonstrated that the abnormal toxicity test had become obsolete. This began a long, regulatory journey towards deletion of ATT worldwide. 20+ years of data analysis, expert reviews, and discussions. The test was deleted from United States regulations in 2015. WHO recommended deletion for all products in 2018. Europe deleted the test in 2019, and Brazil the same year, with only one exception. It was deleted for almost all human vaccines in India in 2020. Japan has waived ATT for some products. It is no longer performed in Argentina, Canada, and South Africa. Around the world, many different stakeholders have been hard at work in the last decades to achieve global deletion of the ATT. Success is in sight, but there is still much work to be done. We need all stakeholders to come together again to plan a strategy for accelerating change. Through cooperation, collaboration, dissemination and trust. Together, we can erase the abnormal toxicity test once and for all. Please join AFSA and EFPIA for a multi-stakeholder international discussion on October 14, 2021.